Good evening, sir.
Good evening. Can you able to hear?
Yes, sir. You are audible, sir.
Yeah.
Could you please share your screen?
Yes. 1 minute. Is it okay?
Yes, sir. It is okay, sir.
Okay. Shall we start now?
Shall I start, sir?
Yeah, you can.
Thank you, sir. Learning is the beginning of wealth. Learning is the beginning of health. Learning is the beginning of spirituality. Having a heart to start learning is where the miracle process all begins. Good evening, everyone. With great joy and immense pleasure, I extend my warm welcome to all dignitaries, guests, and delegates present here for the Dr. Sudhi Raj and Memorial Free Webinar Series organized by DIKSHA E-Learning in association with Ayurveda College, Coimbatore, under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discussing about application of Rasaushadhi's Herbomineral drugs in eye and ENT diseases. Dr. Pundrikaksha Rao, sir. Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling a full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. Next, I would like to invite Dr. Jeeva, Assistant Professor, Department of Shalakya Tantra, Ayurveda College, Coimbatore, to deliver the welcome address. Over to you, ma'am.
Thank you. Good evening, Onanda. On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning, it gives me an immense pleasure to extend a very warm welcome to our guest speaker. As you all know, we have Dr. Pundarikaksha Rao sir to detail into the concept of application of Rasaushadhi in eye and ENT diseases. I extend a warm word of welcome to our guest speaker for accepting our invitation and for being with us here today. Hope this discussion will be one among the best to look into our concept in a new perspective. Let me proudly welcome all the delegates who have joined with us today. Welcome you all once again. Thank you. Thank you, Unanda.
Thank you, ma'am. It's a great pleasure for me to introduce our guest speaker, Dr. Pundrikaksha Rao, sir. Dr. Pundrikaksha Rao, sir, is currently working as Associate Professor and HOD, Department of Shalakya Tantra at Ayurveda College, Coimbatore. Sir has graduated from SV Ayurveda College, Tirupati, and postgraduated from Dr. BRKR Ayurveda College and Hospital, Hyderabad, and completed MA in Sanskrit from PST University, Hyderabad. He has 64 publications in peer-reviewed and indexed international and national journals. Sir has delivered 21 guest lectures and has presented papers in various national and international seminars. We are extremely privileged to have you here in this platform, sir. Now, without any further ado, we will turn the time over to respected Dr. Pundrikaksha Rao, sir, to enlighten our minds with his knowledge. Over to you, sir.
Good evening, one and all. Okay. Today we are going to discuss about some Rasaushadhis, what we can give in Netra Roga and ENT diseases. Okay, all of you know very well that Rasaushadhis are working very fast and it give very better results than Kastaushadhis. All of you, so many doctors, they are practicing with Rasaushadhis. With that, it is like a, sometimes it gives better results, same times it may give some complications also. We have to identify what are the complications we'll get with that particular rasha, and we will reduce that complications. That also very, very important to see. Okay, now I'm going to share my screen. Okay, I'll send the yeah. Is it okay? Is it possible to see?
Yes, sir. It is visible.
Yeah. So here I am going to tell about what are the common Rasaushadhis we can use in eye and ENT diseases. It's very, very important to know few points that all we will cover now. And after that, finally, if we having any doubts, that we will discuss. So why we are using Rasaushadhi in general practice? Because of Kshipram Arogyadayat. It give very fast result. It give very fast result without delay. Okay. Sometimes disease is having that so much of complications. So that everything is subsided with the Rasaushadhis very fastly without harm to body also. If you prepare properly, that's very, very important. If you prepare properly, then it reduce all the diseases. Okay, so I'm going to show one shloka. This is from Rasratna Samuchayam. Dravyam Vishatamam Yuktam Dravyam Vishatamam Yuktam Dravyadika Gunam Bhavet. It is like even though Visha, that Dravya is having that Visha property, that will increase the capacity of the drug. Sudha hala hala yuktam, Sudhadika guna tata. So even though that hala halam is added to the Sudha, Sudha is nothing but Amrutam. Okay, hala hala means Visha. If Visha is added to the Amruta, that Amruta effect also will increase. Like that. So what are the Rasaushadhis we are using? That all are having that complications. It will give complications and it reduce the so many diseases. Same time, it can harm to the body. Okay, that is you should remember, everybody. Okay, so that Rasaushadhi, which is causing the complications if you not properly prepared. That point everybody should keep in your mind. Okay, so some people they are using without knowing anything, they are using Rasaushadhis. Okay, so much of so many doctors they are using. Even though I also using so many Rasaushadhis, usually I prefer to give Rasaushadhis compared to the Kastaushadhis. So we have to identify whether the medicine is properly selected. That's very important. Okay, how? Because sometimes instead of that Yasadam, they use Pittala, or else they use that Vangam. Okay, like that they are using in the different drugs they are selecting, and they are preparing the medicine and they will give. So that time it gives the complications. So that time it will work, even though knowingly or unknowingly, if you are touching fire, you will get burned, isn't it? Same like this, knowingly or unknowingly, if you are using properly purified drug, it will go under where the disease is there the disease is subsided. You given Vangabasvam. Okay, usually Vangabasvam is having that netra property, Chakshusham. Okay, Vangabasvam is Chakshusham is there, and same time Prameharam. Okay, you given Vangabasvam in Netra Roga, it reduces the Prameham. Okay, so it reduces the eye disease also, it reduces the Prameham also. You given Vangabasvam in Karna Roga, there is no proper indication to the Karna Roga. Okay, so if given Vangabasvam in the Karna Roga, it is not reducing the ear disease, but it reduces the Prameha. If the person is having any, okay, patient is okay. If the patient is having any eye diseases, that also will subside. But what is your target? What is your aim? You selected the drug to reduce the ear disease. Patient is he will come after 1 week. Okay, he will come after 1 week and he will tell that my ear pain is not reduced. But what is his eye-related problem is there? What is the prameha levels are changing or urinary problems are there? That will subside. Okay, so proper preparation also we should know. Okay, how the person is prepared, that how the doctor is prepared or how the pharmacy is prepared. Okay, so where you can use that you should know, and what are the complications you will get. So immediately we should overcome the complications. For that purpose, you should be prepared. Okay, and one more thing is that, so whether the medicine is available. Okay, you thought that we should give the medicine. We give the Rasaushadhi, whether it is available or not. Okay, please, can anybody take care about who all are joining? Can admit them, because it's distributing the slides. Okay. Somebody can take care. Okay, so whether the medicine is available or not available. If it is available, so whether you can use for external purpose or internal purpose. For eye diseases or ear diseases or whatever it may be, we can give externally also, we can give internal also. Some Bidalaka yogas contains that Rasaushadhi. Some Anjanas contains the Rasaushadhi. Okay, so Rasaushadhi is not only in giving internally, some external also we can use. Sometimes if it is not available, so we have to prepare that we can use externally or internally. Okay, some related to the eye. Externally in the Anjana we can use, in the Ashwatana is there, in the Bidalaka also we can use Rasaushadhis. Okay, so many references are there. Okay, hundreds of the Anjanas and more than hundreds of the 100 Anjanas is contains the Rasaushadhis. Okay, and internally some vati preparations, some churna preparations is contains the Rasaushadhis. Few things we can discuss because it is a vast. If I take that topic, it will go for 4 to 5 hours. So I'm not going that much. My time is only 1 hour. So important, which is easily can prepare and use, that I'm going to tell. Okay. Now, first I will start with the Parada. Parada contains Sadrasa. Okay, Parada, Sadrasa, Snigdha. Sroto, okay, Tridoshagnam. It is contains the Tridoshagnam. And Rasayanam also. Yogavahi. So, Yogavahi property is there. We can use this Sodhita Paradam with any drug. If you use this Sodhita Paradam along with Triphala, it increases the effect of Triphala. You added with this Shatavari Churna, it increases the effect of Shatavari Churna. Okay, so that Parada is can use in all the eye diseases and ENT diseases also. And how we can use the Rasaushadhi, especially Parada. Okay, what are the rules they told to the Parada that is can be applicable to all other Rasaushadhis also. Okay, so the method it is explained in the Rasamitra. Okay, there is one textbook is there related to Rasa. It is Rasamitra. In that they told that Pratareva Purato Virachanam. Early morning, first you should give the Virachanam to the patient before starting any Rasaushadhis. Okay. And okay, so after that, Taddivat, same day, Upavasana. Person should not take any food. Okay, Lagu Ahara should be taken. Tatparo Akhnicha Patti Sevanam. Okay, so that day, person should take the Patte Bhojana. Okay, so first day we'll give the Virachanam. On the day, Lagu Bhojana only take. Next day, Akhna means next day, we should take the Patte Bhojanam. Tatparo Akhni Rasendra Sevanam. So first day Virachanam and same day we will do the Lagu Aharam only. Next day we take the Patte Bhojanam and third day we start the Rasa. Okay, Parada can be started. This is the point they told. Okay, first Virachanam, next day we can take the Patte Bhojana and third day we'll go for the Rasa taking. And one more point they given continuously, they told, this is a very important point they told. Next to they told, if the person is having that severe disease, no need to wait for Virachana and all. We can give immediately also. That is a line they given in the same Rasamitra textbook. Okay. Next, if the person taken Parada, what will happen? Usually the gums are becoming swollen and changing into the black color, and swelling is developed, and Kushta can develop. So Rajakshma can develop. So many complications you will get if you use the Parada taken. So in that condition, for Vikara Shanti, what we can do? This is very important point. What are the complications we are getting? How to reduce the complication? That also important. So that we'll discuss. So Gandhakam we can give. The person is taking Parada, any complications are developed, immediately Gandhaka should be used. Properly, that should be Shodhana. Shodhita Gandhakam only we can use. Okay, how we can do Gandhaka Shodhana? That is the Dola Yantra. In the Dola Yantra, we put the milk and heated the Gandhaka, liquefied Gandhaka can be poured in that. Different methods also there that can be followed and prepared. Okay, or else Maricha with Dhanyakam plus Sita. Sita means nothing but that Sharkara. Okay. So this also can be given along with the Ajyam. Ajyam means Grutam. Okay. So this is one thing. If is Gandhaka should be given, compulsory should be given Gandhaka. And along with the Maricha, Dhanyaka, Sita with the Grutam. Dhanyakam va Sita yutam. If you can use Sita or without Sita also can be given. That is very important point. Okay, because Paradam is very, very important. For that, I started with Parada. After Parada, we will go each disease, what are the Rasaushadhis can be given. Okay, so Parada can given in all the diseases. Parada is given in all the diseases, especially the Chakshusham. Parada is Chakshusham. And Yogavahi is there along with other drugs also can use. And this is the dose. Commonly, what are the drugs we are using? What are the Rasaushadhis we are using? That drugs only I given here along with the dose. Okay, so this is Rati. Okay, one Rati is usually they are telling 125 mg. Some doctors they are telling that 100 mg. One Rati is 100 mg. Okay, so that controversy is there. 100 mg or 125 mg. You can fix 100 mg. You can fix 125 mg. Whatever it may be. If you feeling that nowadays one more point I have to tell that we all are Madhyama persons. We are not a Pravara persons. Okay, in this Kali Yuga, almost all, especially in this Padam, all people are having the Madhyama Sattva. Okay, Madhyama Prakriti, Madhyama Sattva. So you can take 100 mg. Okay, one Rati can take in as 100 mg. So Swarnamakshik Vasmam or Pravala Vasmam given half to 2 Rati. Loha Vasmam, Manga Vasmam, Yashada Vasmam, Braga Vasmam, Suranga Vasmam, Tankana, you can take 1 to 2 Rati. And Rajata, Naga Vasmam, Mukta Vasmam, 1/4 to 1 Rati. Kasisam, Kamsam, half to 1 Rati. Okay, you can take the screenshot and you can keep with you. If you want to give this medicine, you give in this dose. You remember the dose. I have to tell one very important point. How we can give this each and every time we will be unable to measure it and give. Okay, some doctors what they are doing, they'll take that microwave weight. So they will taking Rasaushadhis and making the small pockets, and they will give to the patient. Okay, you take this powder along with the honey or along with the gruta, along with the proper what is the anupana they told. Okay, along with that they will tell them to mix it and take. But what is the simple method we can follow is I will tell you. Okay, one for example, if you want to give Loha Basmam, okay, Loha Basmam, we can give per day dose 1 to 2 Rati. If the age is very less, we can give 1 Rati. Less than 25 years, we can give 1 Rati. More than that, we can give 2 Rati. Okay, so in that condition, what we can do? By simple technique, I will tell you. Okay, so 1 month dose if you want to give. 1 month dose, how much you can give? We will give the per day 100 mg into that we can sell that 30 days. Okay, so 30 days will give the daily 100 mg. So you calculate that. After that, you add this along with the any caste Aushadhi like Ishtimadu Churnam, Amlaki Churnam, Trifala Churnam, Shatavari Churnam. Okay, so that usually
churna, any churna we can give per day, maximum 3 grams. Okay, maximum 3 grams means 30 days. How much you can give? 33. Okay, so it will come around 90 grams. Okay, so 90 grams you can give maximum. You can reduce that. You can give 60 grams. You can give 45 grams. Accordingly, you can. So in that you mix this loha basma or what vanga basma, whatever you want to do. Okay, you calculate that for the 30 days that you mix with the churna, Rasaushadhi. Okay, you properly mix it. Okay, in the kalvam. Okay, first you can put in the mixie also, no problem. First you can put in the mixie, it will mix properly. Then you put into the kalva and you do proper mardana. So with that, it will mix it totally properly. Okay, even though kalva we are doing also, sometimes it may not mix properly. For that purpose, once you can put in the mixie. Okay, now technology is there, you can use that. Later, put in the kalva yantra, you do mardana. Okay, so like this dose. Okay, you remember the dose and you can give to the patients. And only few drugs, only Rasasindura, they told per age-wise dose. Okay, up to 6 years, we give the 1/4 rati. Okay, after 6 to 12 years, half to 1 rati. More than that, 1 to 2 rati we can give. Okay, remaining all are, this is a fixed dose. Okay, if you feel that in the children, you can give less dose also. And some anupanas. Okay, few drugs having that anupanas that we will see. Abrakabasma we can give with the trifalagruta. Makshikam, trifalagruta. Silajitu will milk and sugar. Okay, so these few, and one more thing, remaining thing we will discuss one by one. And one more very, very important, we have to identify the color of the basma. Okay, so whether that company is prepared properly or not, if or else you prepared basma, whether that is in the proper color or not, that we have to identify. So you can remember this, what is the proper color of the basma. If you properly prepared, it will come in. Okay, Rajata basma, Tamra basma, it comes in the Krishna varnam, Tikshna loham, Jambu phalavarnam, Naga basma, okay, Paravata, okay, Paravata or Kapota varnam. Kamsya, Dusaravarnam, Vanga, Vajravasam, Svetavarnam, Ambrakavasam, Stika, Churnavarnam. Okay. And Tamravasma. Okay. Tamravasma, it is there, Krishnavarnam, commonly we are using in the Krudroga and Netraroga. That one by one we will discuss. Okay. So now basic information we discuss, we'll go for the diseases. There is a pain present in the eyes. Common drug, Saptamurtaloham. Saptamurtaloha is having so many indications in the eye diseases, not only eye diseases. They told Nachaye Kevala Netra Roga for Saptamurtaloham. So many doctors, they are thinking that Saptamurtaloha only for eye diseases. But when we see in Yoga Ratnakara, Baisaj Ratnavali, in that books they told that Nacha Kevala Meva Netra Roga, Karna Danta, Jifwa, Kantaroga, Keshya, they having so many indications, Kamala, Jwara, okay. So it having more than 45 indications for Saptamurtaloha. If you give Kamala, Saptamurtaloha, if you are giving it, some people may scold you. Why you given this drug? It is indicated in Netra Roga. But we are not having proper knowledge. We are not having the proper knowledge. Okay, that is the main thing. And one more thing I am telling today is that my topic is related to Rasaushadhi. For that purpose, I am mostly concentrating on the Rasaushadhis. Along with that, we can use other procedures also. Okay, Bidalaka procedures, Seka procedures, Tarpana procedures. Okay, not only Rasaushadhis. Okay, I selected Rasaushadhi. For that, I am telling that Rasaushadhi is best. As a Shalika person, I should follow. I am telling to you also should follow the other procedures. Okay, not only Rasaushadhis will work. Okay, Rasaushadhi internally they will start working, and same time some other procedures also have to do. Otherwise, Sushruta will tell all the procedures, Kriya Kalpas and all. Okay, and this is one very important yoga for the Bidalaka purpose. You see here, Gairikam is there in this. It is a reference, friends. Rasa Kamadenu. Okay, in the Rasa Kamadenu, they told Esti Gairika Sindutta Darvi Taksha Sa samamshakau. Jalapishter bahirlepo. Sarvanetra rujapaha. Okay. Tarksham is there and Gairikam is there. Okay. That we will prepare and apply as a bidalakam. It reduces all type of the pains. And one more reference. Rasa Pradipa. In this, they told that it is a netrim. Okay, Gairikam is netrim. Rakta Pittanut. Rakta Pittaharam. Okay, so whenever you feel there is a Rakta involvement is there, Pitta involvement is there, burning sensation is there in the eyes, and redness is there along with the pain. Okay, so we can use Gairika as a bidalaka. Okay, one ingredient in the bidalaka. I used to prepare bidalaka with Gairikam. Okay, you see there is a Gairika varnam. There is you can see maroon color. Okay, that is the Gairikam. That in the I given in the plate. Okay, so usually I prepare if I feel that there is a Tridosha Vyadhi. In the Tridosha Vyadhi, I will add the Gairikam also. Not only the Rakta Pitta Vikara. In the Tridosha, Rakta also there, Pitta also involvement is there. Okay, in the Sannipata Vyadhi. Okay. And one more yoga from Rasakamadenu, Saindavam, Daru Haritra, Gairikamadi, Rasanjanam Pishto, Datva Bahir Prilepa. It is also Sarva Akshiroganutta. This is also Pavatya Shesha Akshirogahara. Okay, all the eye diseases. This Bidalaka can be used. And here you remember this. This Acharya, he told that Sarva Akshira, that is Rogaharam. Okay. In this Sarva Akshirogaharam, he told Bidalaka have to apply. But when we see that Bidalako Bahirlebo Netra Pakshma Virjitaha, we have to apply externally properly in that. Utpanna Matre Tarune Netra Roge Bidalakaha. Utpanna Matre Tarune Netra Roge Bidalakaha. So that is okay, we should implement all other rules also. Not only this point, you take in this loka and you given this Bidalaka application in the Drishtigata Roga. Will not get that much of result. Why? Because Utpanna Matre Tarune Netra Roge Bidalaka. If the disease is developed immediately, only it can subside. And this will subside only the diseases which is developed in the superficial portion of the eye. Bidalaka is working only in the superficial diseases, only eyelid diseases, only conjunctival diseases, only the external skin related, that only it subsided. Not in the deep portions. Okay, in case Sarvara Akshanogana, that is only the external parts of the eye. That other concepts also you should remember. Okay, so this is once if you added Bidalaka, that Gairika in the Bidalaka, it looks like this color. Okay, it will change along with the other ingredients. And one in the Rasakamadenu, they told one Sulahara Patti. Okay, so Patti means nothing but one cloth. Medicine is applied to the cloth and placed on the eyes and tied. Okay, that is we call as a Patti. Okay, it is not explained in all. You can tell this as a Kavalika like. Sometimes you can take, but Kavalika is different. Okay, medicated paste placed on the cloth and placed on the eyes and tied. But in this, medicated paste is applied to the cloth. Okay, it is applied to the cloth. For that only they told as a Patti. Now belladonna plaster is available. No? So same like this. This medicine is applied to the cloth. And in this Shunti Pipali Saindava, okay, that all we should kept in the Shembuka. Okay, Shembuka shell. Shembuka shell is nothing but small type of the shell. Okay, conch shell. Okay, small type of the conch shell that we can put into the putam. Okay, filled with that. After that, we'll do putam. Later, you collected that medicine and applied with the honey to the cloth and tied on the eyes. That is the Sulahara Patti explained in Rasakama there. Okay, so if the burning sensation is there, we can use Gairikam, no problem. Along with that, some other yogas, some Mukta Sukti Basma is also having the Dahaharam and Pravala Basma also. These drugs, this Rasaushadhi, show that the Rasaushadhis will mix with any Chandana or Usira or Shariva, accordingly what I told previously, the ratio, how we can mix, that we can mix it and apply in the all the patients. Anupanam will give as a Kshiram. Silajitu also It's one of the very important drug in the netra burning sensation. And Shilajit is the Rasayanam and Chakshusham. If any complication happen with Shilajit, for dosha shanti purpose, what we can do? Maricham Guta Samyuktam. Sevanadi Saptakam. We should do for 7 days. Maricha, Gruta, we should mix it and give for the 7 days. That is for the reducing the complications of Shilajit. Commonly, we are using Gomutra Shilajit and Karpura Shilajit according to that Loha involvement, Swarna, Rajita, Tamra, like that 5 types they explained. That all already, you know, there is no time to discuss all the things. Okay, we can use Triphala along with the Shilajit and we can give internally. Okay, so burning sensation, already I told, some other procedures also we have to involve. If there is a redness present, Gairikam also one special drug we can use in this. Okay, Mukta Pishti also reduce the redness, and Saptamatalo also having that Raga. Okay, Raga is one indication for the Saptamatalo. Raga is nothing but redness. Okay, so in which all are diseases that redness is developed, that all you should know. Okay, that is your part too. Previously in the previous webinars we discussed all the things. Today we'll concentrate only the Rasaushadhi. Okay, so Kamadoda is also one best drug we can mix with Avipatti Churna. Okay, we can mix with Avipatti Churna and we can give internally, or you can mix with Shatavari Churna or Triphala Churna also. We can give internally. Kamadoda is indicated in the GAT diseases. Okay, why we are giving in this? That all the silly questions. Okay, and other procedures we can do. Next, Tuvari. Okay, what is Tuvari? Tuvari is nothing but Patika or Fatika. Okay, we are doing Fatika. So this Basma, Fatika Basma, it is very easy to prepare. That Fatika Basma is called as a Subra Basma. Okay, commonly in some companies they are preparing Subra Basma medicine. Okay, Subra Basma is nothing but Fatika Alam. Okay, the Shodhita Alam. Nothing but we have to fry it. We have to fry it. That is the Shodhana part. Okay, we take the pan and we will fry. Okay, so what is the guna of this tuvari or Fatika Alam? Is nothing but Vishanashini. Wherever you feel there is any insect bite is there, any insect bites are there on the eyes. Okay, or anything is entered. Sometimes any poisonous things are entered. Some sprays are entered in the eyes, or whatever it has entered inside, chemicals. Okay, all we can use this one. And Kshata Sulagni, any injury is developed in the eyes and cause the pain. To reduce that also, we can use this tuvari. Okay, this image company, they are preparing Netra Bindu eye drops. Okay, this Netra Bindu eye drops is nothing but the Suprabhasma is mixed with the water and boiled continuously and reduced and filtered and kept in the bottle. So that we can use as a eye drops. Okay, Netra Bindu eye drops. It's very, very easy. Only one ingredient is there in the Netra Bindu. Nothing but this Shodhita Tuvari. Okay, or Subrabhasma. If you feel, if you want to reduce the more burning sensation, that time you can add the this rose water also. Okay, we can boil with rose water also. We can use for the Ashotana purpose. If the person is having the more watering in the eyes, this is one best drug I observed in my practice. Chandra Prabhavati. Chandra Prabhavati is indicated in the Mutra Vikaras, but I observed my teachers also, they told that Chandra Prabhavati they can use. Okay, we can use that. So I learned from them and I am using this. Chandra Prabhavati is very effective in Netra Srava. Okay, actually Netra Srava is the Asadhya Vyadhi. Okay, Netra Srava is Asadhya Vyadhi, but Jalasrava is Sadhya Vyadhi according to Ashtanga Hridaya. Okay, if it is in the acute condition, we can use the thing. So Rasaushadhi is having that one more point I have to tell, because this is my thing to tell to you. Rasaushadhi is having the Rasayana properties. What I am telling, this all are Rasayanis. Okay, this all what I am telling in the Chakshushya drugs, all are having the Rasayana property. You keep in your mind. Okay, this all are the Rasayanas. This Rasayana Dravyas is having that capacity to cure the Asadhya Vyadhi also. There is one reference is there. In the Asadhya Vyadhi also, we can cure with the Rasayana. But we have to do the proper Shodhanas, and after that only we start the Rasayana Dravyas. Okay, so don't leave the Asadhya Vyadhis. You start the treatment. And other procedures, if there watering is there, Anjana application is there, Sekam also we have to do. That all are also can. Okay, internally you give Chandra Prabhavati along with the local procedures. Now we will discuss about the vision related abnormalities. Okay, so many vision related abnormalities are there. Some people with their refractive errors or cataract, diabetic retinopathy, glaucoma, retinitis pigmentosa, Eels disease, hypertensive retinopathy. Like that, so many diseases are there. Okay, everything in classics they told as a chakshusham. If they are telling chakshusham means or netrem or chakshusham, if they are giving means. Chakshusha is especially vision related. Okay, netram also vision related. Netra rogagnam, if they are telling means you can use in the other diseases also. Netram or chakshusham word is there, nothing but it is a vision improving drug. Okay, different anjanas. Okay, there are 5 types of anjanas they explained in the classics. I am telling about the anjana dravya. Okay, Anjana Dravyas are 5 types. All of you know, Saviranjanam, that all things. Okay, that I will show in the next slide. This Anjana is having the capacity to reduce the vision abnormalities and same time you give the strength to the optic nerve. Okay, the optic center also. Okay, cerebral cortex, the optic center is there. That also get nourished with this. Okay, Anjana we are applying on this particularly in the eyelid, and it go and work. Okay, so these are the 5 types of Anjanas. You know very well about that. There is no time to discuss each and everything. And very, very important to remember. Please, doctors, you remember this point. What are the Rasaushadhis we are using in the eye? Okay, that is followed. Okay, the doctor should follow. The doctor should tell to the patient to follow these things. Okay, Srante, Prarudite, Bite, Pitamadye Navajvare, Ajirne Vegagatecha, Anjanam na Prashashyate. Okay, it is from Rasamanjari. Okay, this is from Rasamanjari. In that they told, this is there in the Susruta also, that contraindication they explain. Rasamanjari he mentioned means what are the anjanas which is prepared with Rasaushadhis. That person should not do these things. Okay, if there is a person is frightened, you should not apply, especially the anjana in the anjana as the ingredient in the anjana. That should not be followed in this person. Prarudite, already he cried, should not use this. Bite, feared, should not use. Okay, Pita Madhye, he alcohol he taken, we should not use. Namajvara condition also, Ajirna condition also, and Vega Dharanam. In that should not use the anjanam. This is for especially Rasaushadhi contained anjanas. Now, commonly it is Chandrodevarti is available in the market. This is from Rasachintamani, Trutya Haritaki is the Vacha is the Vipali, Vibitaki, Ishtimadu, Sankanabi is there, Manasila is there. So it is different type of Netra Roga we can use here, especially the Drishti related, vision related abnormality. This can reduce the redness also. Okay, Chandrodevarti. It's easily available in the market, Chandrodevarti. And Nayanamrutanjana also is available. The Kotakal company, they are preparing this. Okay, Nayanamrutanjana, it is also one of the vision improving drug, but person is getting severe irritation and redness. Okay, immediately Pratyanjana have to apply it. Okay, because it contains Paradam is there. Okay, there is a sesame is there. Okay, Nilanjanam, Karpura. Okay, these are the ingredients in this. And there is if pterygium present, if there is arma or pterygium present, okay, there is one special anjana explained that anjana should apply directly on the arma. Okay, that anjana should apply directly on the arma, not like a behind the, not only behind the eyelid. Okay, not only behind the eyelid. That is, there is one tuttanjanam is there. So with this, even though chronic, long-standing arma also subsided. Okay, but patient get severe irritation like anything. Eye become fully red. Okay, so this, okay, I applied this in one patient. Okay, I prepared for him and applied, and the person got severe irritation. Okay, severe irritation. Immediately I did the Kshira Sekam. Okay, Kshira Sekam I did. I expected, because what I am doing is that what are the anjana I prepared with whatever that anjana I prepared, that first I applied to my eyes. I used to do that. Okay, I apply to my eyes. I observe how much Tikshnata is there. Later only I give to the patient. I observed that I got severe irritation and redness. My eye was also become full red. Then after that I did the, but simple, I took the one glass of milk. I kept my eyes and I did, because I am staying alone. So I should do procedure to myself. Okay, for that purpose I followed this technique. Okay, I took the glass and I kept. Next, some anjanas which all are having the Rasaushadhis. See, Bhanumati Varti, Chandraprabha Varti, Chandrodaya Varti, Chandro. Okay, repeated. Chandra Kalavarti is there. Chandra Prabhavarti is there. Bhaskaravarti is there. Timirantakavarti is there. Dushti Pradavarti is there. Okay. Dushti Shuddhi Varti. Garudanjana. Different Anjanas are there. Nagarjuna Varti. Saindava Danjana. Puspakasi Sanjana. This Puspakasi Sanjana is indicated in the Pakshmagata Vikara. Okay. Hundreds of Vartis are there with the Rasaushadhis. Okay. So no companies are preparing all these anjanas. Only few number, okay, 2 or 3 anjanas only they're preparing. If the person is having the refractive errors, okay, one thing we have to do is that we prepare ourselves and we give to the patient. That's all. Saptamrtaloha we can give internally, especially from Yoga Ratnakara reference, and Yashada Basma, Vanga Basma also we can use in the refractive errors, Swarnamakshik Basma also. In this refractive errors, there is a Triphala is when best drug. Okay, Triphala is the best drug. Along with Triphala, we can add the Yashada Basma, Estimadu Churna, and I already told you, you can add that ratio. Okay, 30 grams of this and 30 grams of Triphala Churna, 30 grams of this Estimadu Churna. And if the person is having any color vision related abnormalities, in that condition we add the Bhrungaraja. I observed in my practice, Bhrungaraja is very, very effective drug in the vision related, especially color vision related abnormalities. Okay, so you can add that also if the person is feeling like that. So, and Vangabhasma is the Chakshusham is there, and Prameha Haram. Vangabhasma is Prameha Haram. So if diabetic retinopathy is there, in that condition you use the Vangabhasma as one ingredient in your prepared drug. This Swarnabhasma, you know very well, Swarna is the one of the high potent drug can use in the all the diseases, and especially in the Netra Roga, along with Punarnava. There is a Rasa Chintamani they told. Okay, along with Punarnava, it reduced all the Drushti related abnormalities. Okay, this glaucoma also vision is reduced. There you can use diabetic retinopathy, you can use optic neuritis, you can use. Okay, all the vision related abnormalities, we can give the Swarnabhasma if the patient is affordable. Okay, this is Vayastapakam. You remember this Vayastapakam. Vayastapakam anna, it stop the damage. It stop the damage to the age. Okay, age will stop. Vision abnormality also will stop. Okay, usually after 60 years, okay, according to Sharangadara, after 60 years vision can decrease. Okay, so in that condition, if the person if taken that this medicine Vayastapanam, it age also reduce, then degenerative changes also will reverse. Okay, and Vakshuddhikaram. Vakshuddhikaram means what are the things he is telling, it will happen. Okay, Adanalla who all are taking Swarnavasma, we should not hurt that persons. it is alternate for the Swarna Basma. We can use Swarna Makshika Basma as an alternate to the above Pratindra Dravyam because it is not that much of costly. So many these complications also they told that so many diseases can develop if you are not properly purified. This also Ishtika Varnam. This Swarna Makshika Basma color also Ishtika Varnam. Okay, Loha Basma also Ishtika Varnam like that. Okay. So if the complications happened, what we can use? Kulutta Kashaya. Okay, there is one reference is there in the Rasamitra book. I referred so many books and I prepared notes. Okay, for this purpose. Okay, even because I used to use the Rasaushadhi. Okay. Luckily, till now, I not in my 10 years of practice, I not observed any complications with the because I give the less dose, not in the high dose. Okay, I take the 100 matra kala, sorry, 100 mg only as a rati. Okay, like that I mix with the things, other ingredients, and I give. If you give directly basma to the patient get the complications. Okay, so simple way is that you mix with the Rasaushadhis and give. With that, the patient also will not use the overdose. Okay, so Kulutta Kashayena Makshikam Vikrutam Jayet. So what are the complications are developed that can be subsided with the Kulutta Kashaya, or else Darimasya Tvachavapi Rokta Vikruti Vinashini Rasa. Okay, Vinashini. This is reference from Rasamrita. Okay. So Vikruta, what are the complications are developed that can be subsided with the Darima Tvacha, that Kashaya. Rajata Basma. Okay. This Rajata Basma is the second rank. Okay. Second to Swarna. Rajata also having the Chakshusha property. Okay. Suddham Basmikrutam Ropyam. Samanvitam. Netra Roga api sada Kshayajan Gudajan api. Netra Roga napi. It is reduce the eye disease. Okay. It increase the vision. Rajata Basma. And one more thing is that especially they told Swarna Basma, Rajata Basma, Swarna Makshika Basma, Tamra Basma, this should not give alone. Especially there is a direct reference is there. If you want, you can check in the this Rasa Ratna Samuchaya and Rasamitra book. Okay, you check once. You will see some other books also they given. Should not give Rajata Basma alone. Rajata Basma should mix with some other. Okay, if you want to use Rajata Basma in the Mutra Vikaras, you mix with Punarnava. If you want to use in the GIT related diseases, you can mix with that in the Trikatu Churna, or what are the drugs common, okay, we can use commonly in the particular system. Okay, like Krudroga along with the Arjuna you can mix. Okay, like that. Okay, okay, that is very, very important point to the Swarna, Rajata, Swarna Makshika, Tamra. Swarna Basmam they told like that should not give Swarna Basmam with taken with honey. Okay. Loha Basma. Loha Basma also they told that we should give Loha Basma with the Trifala. Okay, we should give Loha Basma with the Trifala, Madhu, Gruta, Kshira, anyone. Okay, this is the for any complications develop also we can use same things. What are the complications you'll see? There is a mrityu, death also can happen unpurified, if we are not properly purified and given. Okay, it's also Chakshusam, best drug in the vision related abnormalities and Netra Sula Haram also. Okay, I observed in the refractive errors. Okay, Loha Basma I used to mix with Testi Madhu Churna and I give. While taking Loha Basma, Kusmanda, Tilataila, Masa, Madhya, Amla should not taken. Okay, so these are very, very important things. And Kakarashtaka should not taken in the Parada. Okay, that all things already you know, no need to tell all the points. In the glaucoma condition, especially what is the target in the glaucoma? We have to reduce the pain. Okay, mainly patient get the pain and field vision defect, and along with the vision is gradually decreasing in the glaucoma. So we have to reduce the pain. So for that purpose, why the person is getting the pain in the glaucoma? Only because of rising of intraocular pressure. We should reduce the intraocular pressure. Automatically pain is subsided. Okay. So if you are using anjanas, with that what happened? The patient is getting tears, continuously get the tears. Even though a small foreign body entered, will get more tears. If you are Tikshna anjana, we are applied, especially that Rasaushadhi related anjanas, if you are applied, patient get continuously tears. We should not stop the tears. It's very important. With that, what happened? There is a usually the aqueous humor is drained from the this limbus area. It is entered into the circulation. But because of this anjana application, forcibly that aqueous humor also some amount is escaped from that. Okay, when we see there is a tear film. In the tear film, there is 3 layers are there. Okay, and the tear film contains 3 layers. Okay, there is a mucus layer is there, and aqueous layer is there, and along with the lipid layer is there. Externally, lipid layer. Middle one is the aqueous. So some amount of the aqueous humor, some amount of aqueous humor is escaped and from the tear film. So that is the method identified in the olden days. The doctors, their acharyas, they using the Tikshna anjanas to reduce the glaucoma, and especially in the Adimanda conditions. And okay, Narikela anjana we can use, Chandanada anjana, Chandrodayavarti commonly can use. So many anjanas are explained in the Adimanda. Okay, especially this Chandra Prabhavati, already I told you, we can use this, reduce the Netra Srava, and along with the same time in the glaucoma condition also, it's very effective, Chandra Prabhavati, and we have to give the nourishment. So we will add the Swarnamakshika Basma along with the other powders, Triphala Churna, like that we can mix it and can give. In diabetic retinopathy, our main principle is that we have to stop the bleeding and give the regeneration of the all the walls of the blood vessel. Okay, so for that purpose, Rasayana therapy is very, very important. For stop bleeding, we will use. Okay, so one thing is that stop the bleeding and same time regenerate the blood vessels. In the diabetic retinopathy, we will observe so much of hemorrhage. Okay, mainly diabetic retinopathy is developed because of loss of oxygen supply to the retina. That is the basic thing is cause for the diabetic retinopathy. So oxygen supply is not happen. To get the oxygen supply, what happened? Microaneurysm, small, there is a dilatation of the blood vessels is happening. After that, proliferation also happens in the proliferative diabetic retinopathy conditions. Sometimes the blood vessels are breaking. Okay, breaking, and that retina is thinking that need more oxygen. For that purpose, blood vessels break. If it is breaking, blood is coming out, oxygen can reach to the retina. That is, the retina is thinking like that. For that purpose, blood vessels are breaking. So what we have to do is that we have to give proper circulation. Okay, so proper circulation can happen to the retina. That is main ultimate thing. Okay, so same time bleeding should not happen. Once the bleeding is happening, because of that, what happened? That is irregularities happening in the blood vessels and the retinal layers, and the vision is not properly happening. Okay, so in this, the drugs we can Vasa Churnam also we can use, Vasa Rishta we can use, Vasa Guruchadi Kashayam we can use. What are the drugs which is having that Vasa? That is Anupana for this drugs. Pangabhasma, Nagabhasma, Yashodabhasma. What I am telling is that what is my identification is I am explaining you. Okay, you may using other drugs also, you can improve. Just my points you can add to your knowledge. You see Yashodabhasma in the Rasamrita, they told that Chakshusham Yashadam Meha Pandu Swasha Vinasanam. You see, it is a Chakshushya and Meha Haram. Meha means nothing but Premeha, or Madhumeha is one type in that. So diabetic retinopathy condition, we can use this one, Yashodabhasma. Okay, you more than this, what you need the direct reference. More than this, what you need the direct reference. Okay, so such drugs we can practice. Next, Kasism. This Kasism is Pittaharam Sitalam. Okay. You can use what is the Pitta Vikaras. Okay. Pittajanna Timiras, Pittaja, all the vision related abnormalities or other diseases also you can use this. And Netra Roga Krut. Not only Netra Roga, Mukha Kesha Ranjana Karam. It increases the color. Okay. Dark hairs also you can get. Next, Tuttam. This Tuttam you see in the Rasamitra book, they told that Nadinam Balakruta Param. Nadinam Balakruta Param. Nadinam Balakruta Param. That is, they told systemic, it increased the strength to the all the nerves. Eye related nerve, optic nerve. Ear related, auditory nerve. Nose related, olfactory nerve. See, all this nerve related abnormalities. There is a anosmia is there. Patient is not having that anosmia. Smell is not getting. Add the tuttam. Okay, the person is not able to hear. Tutta related drugs you can give internally. Okay, so that if any complications happen, lime juice used for the 3 days. This is also reference is there. Okay, complications should be reduced. It is Chakshusham. Next, Abrakabasma. Abrakabasma usually will give in the respiratory diseases. You can use in the penasam also. There is direct reference is there for Abrakam. You can use in the penasam. Penasa Nasa Roga. Okay, in the Pratishaya penasas we can use. In the Netra Roga, we use with Triphala and Madhu, especially. If you want to get Sikti to Drushti, they told that Društikaram. If you want to get increase the Drushti, we use Madhu and Triphala. They given Netra Roga separately given and Drushti Shakti purpose we give with Madhu and Triphala. Okay, this is a reference from Rasachintamani Pradhamakanda. Okay, already I told you Saptamurtaloha is one of the best drug. See, indications, redness, burning sensation, itching, all Timira. They told Timira, Kacha, Linganasha. Drushti Pradham, they told. Drushti Pradham for the Saptamurtaloha. Okay. Cherdi, Sula, Amlapitta, Jwara, this all are. Along with that, Dardium, Danta Dardium. Okay, we can use Keshium, it is Kesha indication is there. Okay, Karna Vikara is there, Jiffa Vikara is there. Okay, so many indications for Saptamurtaloha. See how beautiful it is. So many companies are there preparing. So many companies are there preparing Saptamurtaloha. Which company is best? If you prepare your own, that is the best than all other companies. Okay, usually in so many practices, there are so many doctors they are using the Saptamurtaloha. Okay, from different. Usually they prefer Baidyanath or Dabur or Dudh Papeswar, whatever it may be. You prepare yourself. I tell you, I prefer repeatedly. I am telling in the so many seminars what are things happening that I used to tell that you prepare according to Yoga Ratnakara. Okay, Triphala Tvacha, Ayasancha Churnam, Samayastu Madhukam, Trisaptaratram. Usually all these companies, what they are doing is that Triphala, everything is taking one part. Okay, Amlaki Haritaki means that they're taking that Triphala is the 3 parts they are taking, and this Estimadu 1 part, Lohavasam 1 part they're preparing. Some companies they are giving the powder form, some companies they are giving in the tablet form. Okay, we don't know whether that is Saptamurtaloha or Panchamurtaloha Tiriyadu. Okay, we don't know that. Only 5 ingredients they are adding, or Gruta Madhu they are mixing or not. Exactly, we don't know. They will tell that we should take the drug with the Madhu and Gruta like that. They are giving in the pamphlet and say what is they are giving in that. Okay, so if you are having any doubt, you take it and you mix. You tell the patient to take with Madhu and Guta. Don't get anything in the Prameha condition. We can give Madhu or not. We can give Prameha also. Direct indication is there. Madhu we can give in the Prameha, Madhumeha conditions. Don't worry about that. And some people they are getting that Gruta and Madhu should not mix and give. There is direct reference is there. We are giving that will be work like a Visham. It will work like a Visham, but if you taken only Madhu Gruta taken only, it will work like a Visham. If you are adding single one drug with simple, if you added along with Madhu Gruta, simple Sarkara added also, it will not become like a Visham. Okay. Along with other Dravya Samyutam, it will not get any complications. We are with, that is, we are mixing this with Trifala Churna and Eshtimadu Churna and all. Okay, will not get any complications. Don't worry about that. Different companies they are preparing already. We know this. Next, Tamravasam. Okay, Tamravasam, it contains, that is indicated in Netra Roga, Pinasa, Pandu, Swasa, Kasa, like that. So many indications. Pudroga, like that. So many indications are there. But complications are patient is getting the Cherdi, Kushta, Kshaya. Okay, like that. Next, Dosha Shanti. If we are getting any complications, we feel that, okay, simple card, there is Dadi Sevan also is they mentioned, okay, or else you can give Dhanya Kwata. There is Dhanya coriander seeds, okay, Dhanya Kwata prepared and add small quantity of misri given for 3 days. And one more is there, Munivrihi, okay, there is one variety of Vrihi Dhanya, misri and Jala, we mix it and you can give, okay. Dadi also we can give in this to reduce the complications. And one more thing I have to tell related to Tamravasma. Tamravasma is having that Lekanam and Chakshusham. Okay, Lekana property is there. Lekana property, because of that, where you need, there is a Abhishandikara Dravyas who all are taking, the persons getting IDCs. To reduce that also, use the Tamravasma. And one more thing is that if there is a diabetic retinopathy is there also we can use. Okay, Lekana property is there. It remove all the blood is hemorrhages which is stagnated in the retinal layers and retinitis pigmentosa. Okay, in such conditions, wherever you need that, we can use the Tamra Basma. And Gandhakam. Okay, then Gandhakam, they told it is a Chakshusham, one best Chakshusham. I will tell you one more point. In Netra Roga, we can give Gandhaka with Pippali and Haritaki. And if you're getting any complications, we give the Kshiram, Gokshiram. And Trifala Kashayam also we can give to reduce the complications. It is indicated that is a direct reference is there, all inflammatory diseases, and it gives the Grudra Drishti. Okay. In Rasamitra, they told that Grudra Akshitulyam Kurute Akshmi Yugma. Okay. It give Grudra Akshi, like a vulture like, okay, eagle like vision will get. They told Akshi Yugmam. Varu means not like a one eye, one single eye, because usually eagle is having that more vision in one eye. Compare means it contains 2 eyes, but 2 eyes is having that 2 different views. Okay, one eye is observing one side, one eye is observing another side. Okay, it is happening into the eagle. Okay, for us human beings, we having both eyes in the front. Okay, so like that, not like the vulture, he is having one eye vision, not like that. It gives the vision into the Akshi Yugmam, both eyes vision will increase. Okay, unknowingly, if you are giving one person is having that one eye problem, that another eye also vision also will increase. So Gandhaka Rasayana is one of the best thing. Okay, so different companies they are preparing Jendu and Baitanada all thing. Jendu is following that proper preparation method and all. So you can see that they will give that all the what method they followed. Okay, we have to observe once. Okay, which method they followed. In this Baidyanath people, they are adding Misri also along with the Gandhakam. And one Gugulu. This one Gugulu, Shatasuklahara Gugulu also contains the Rasadravya. Loha Basam is there in this. Okay, this is indicated in Suklagata Roga. All like Arma, we can give Pingankula condition. In all this is Suklagata Rogas, we can use Arjuna condition, everything. And Kacha Roga, okay, Drishtagata Roga, persons who are having that complication, if you are not treated Timira, it's changing into Kacha. In that condition also, we can give this one. Few other drugs, Varatika, Netram, Girisinduram, Pravalam, Gairikam, this all are having the netra property. And one more thing, netram, they told that you have to think is that what is the dosha is it reducing. So kapha vata haram. So kapha vata vikaras, kapha dosha, vata dosha is reducing. Same time, who having that netra vikara with kapha dosha, netra vikara with vata dosha, like vata netra roga will subside, kapha netra roga will subside, like that. If you are giving that in the pitta vikara, it will not give that much of effect. But Kirisinduram we can give. And Ratna Dharanam. Okay, Chakshushya Dharanartham. Okay, if you are using all the Ratnas, simple, any Ratna, you making into as a ring and using also, it increase the vision. Particularly that related to disease, we can use the thing. Especially they told this Mukta and next Ruby. If you are using in the rings, it will increase the vision. Tutta Mudrika, like different things also explained. Okay, now, okay, within 5 minutes I'll complete, because I told for that only, I told it will take more than 3 to 5 hours if you go like that. Okay, and that I giving only idea to you. After that you can develop. You do later your work, because our stipulated time is 1 hour only. I think I exceeded already more than that. Okay, maximum within 5 minutes I'll complete. Okay, so many yogas are there with the in the different Sirasula, the Vajras, everybody knows it is indicated in the all type of Sirasulas. I observed so many people, this is working a lot. You can give the Sirasula, the Vajras with the Rasna Churnam or Rasna Saptaka Kashayam. Okay, it reduces that Vatam and same times reduce the Sirasula. Okay, so any Vatahara Kashaya you can give. Vatahara Asavarishtas also you can give. Okay, along with this. Okay, you tell that we make it powder and mix with the Asavarishta, and especially you tell them to take after food. It's very, very important if you giving along with the Asavarishtas in this condition. And Lakshmi Vilasas, everybody knows it is indicated in the Nasa Rogas. Okay, it's very effective. Yesterday, one patient, she told that she was suffering sneezing like anything. Okay, whenever she wake up, she get more than 15 to 20 continuous sneezings. I told her previously, she having that, not only that, she having that nasal polyp is there and other complications also there. So I given this Lakshmi Vilasas. Yesterday she came to KVP and told that she having that drug is very effective. Whenever she having the sneezings, immediately she take that. Okay, it is totally subsided. Whenever if any allergens are there, immediately she take the tablet. Okay, I told her mix with the honey and take. So it's very effective. And this their Dabur company, they're preparing Lakshmi Vilasas as a Naradiya Lakshmi Vilasas, because this is a Narada Prokta. Okay, Narada told it is indicated in the Jwarasikitsa, it is indicated explained in Jwarasikitsa Adhyaya by Sajaratnavali. This also not that much of Mahalakshmi Vilasas. Okay, it having the less ingredients, and usually Mahalakshmi Vilasas it contains Swarnam. I don't know which company they are following using the Swarnam or not, that I don't. I'm sorry if any company related people are there, sorry to say. And this is one of my best drug in the Nasa Roga and Mukha Roga. Okay, so this Swarna Suryavarti, whenever I go home, I'll purchase some 10 bottles and come to here Coimbatore, because here it is not available. Okay, so Imis company preparing, and another one is Chintaluru Pharmacy also, they're preparing this Swarnamakshika, sorry, Manfar Pharmacy. Okay, Manfar Pharmacy and Imis company, they're preparing this Swarna Suravati. Some other companies also, this company one more down I given, and that company they told that in bracket they go without Swarna. Actually, Swarnamakshika is not contains, Swarna Suravati is not contains Swarna. These people, especially some people, they may think that it contains Swarna. For that purpose, in bracket they written like without Swarna. Like actually there is no Swarna in the Swarna Suryavati. Okay, so these all are the ingredients. It's very, very effective. It is who all are having that continuous sneezing, nasal discharge is a Dushta Pratishyaya sinusitis conditions. It's working like anything. This okay. You add this with Trikatu Churnam. Okay, you add this with Talisadi Churnam. Okay, you can give. Okay, accordingly, Estimadu. Okay, Estimadu is one of the best cortisone in Ayurveda. You can mix with Estimadu Churna, Trikatu Churna, Swarna Suryavarti, and give. Actually, this is it contains camphor also. Okay, looking very good smell, and because of Gairic and all, Casis and all, it is look like maroon color powder is there. Okay, very effective and fast acting. Okay, very fast acting because of the all other ingredients. And Sringavasam also best thing we can use in the sinusitis condition. Okay, Dushtakatishaya Pinasa condition, Sringavasma is. Okay, I don't know whether they're properly preparing with Sringa and doing. I don't know. Nowadays, this Vyas company and this Sringa, this AVP company also not preparing Sringavasma. It is drug is not available. Okay, so I went to Andhra and I inquired in one medical shop. The person is telling that we will ask in the AVP and we will bring like. They don't know that I am working in the AVP attached college and all. Okay, so they're telling that we'll talk with them and we'll bring like that. But it is not available in Coimbatore also. In Sirasula conditions, we can use the best one is the Godanti Basma. Okay, Godanti Basma is working like anything. Okay, so in that Baidyanath company, Godanti Basmam, in brackets they are writing like the Haritala. Okay, Godanta Haritala Basmam. This Chintaluru pharmacy, Godanti Basmam, they are preparing. In bracket, they written like a Silajitu Basma. Okay, so Silajitu Basma, they are giving as a Godanti Basma by the Chintaluru pharmacy. That is, it is in Andhra Pradesh. And another one is that Baidyanath company, they are giving Haritala Basma as a Godanti Basma. Okay. Actually, this Silajitu also having the Sirasula Haram. Okay, if using that medicine also, don't worry, it's subside that. And Godanti Misran is there. Godanti Misran is Jwaraharam. Okay, Jwaraharam, Sirasula Haram. Okay, in the Rasamitra, they told that Sirasula Haram Sreshtam Pittagnasya Visheshataha. Okay, it is Vishesha Pittaharam. In Karnasula, there is a Tankana Vasma we can use along with that other yogas. Okay, you can use Sutaptam Tankane Brustam Karnasula Kshanam Jayet. Okay, immediately it reduces the pain in the ear. Okay, actually, when yesterday I was checking this. Okay, actually I not use this yoga. I'm going to apply in my practice. Okay, this yesterday only I got this one, Vasakamadenu reference. Okay, other areas some that sign the Samudra Fena Churna filling is there, like that is there in the classics, other textbooks. In the Rasakamadenu, in that book, they told that Tankana Vasma can put in the ear. Okay, it reduces the pain. Okay, this I will implement. I am telling openly. And next, this is also one of my best drug, Suryavarti. This also reducing headache. Mainly Ardha Vetakam and Suryavartam. This Lagu Suryavarti is very effective. Okay, in Ardha Vetakam and Suryavartam. Sharivadivati, best in the Karna Nadi, Karna Srava condition, and block in the ear. Some people Karna Pratinaha. Okay, they'll block in the ear. Okay, heaviness and block like when there is a middle ear is filled with pus and all. Okay, that is the CSOM, ASOM conditions. We use the Sarivadivati. This is also nowadays very rarely we are getting from Baidyanath. Okay, because immediately stock will complete. Once stock is released, immediately the stock is over. Anupanam is milk. Okay, Karnasula in that condition is very effective also. And Dantasula Haramanjan, this is for reducing the inflammation in the gums and all. Commonly for we are applying with water. Okay, Dantasula Haramanjan or Dantamanjan, we are applying with water to reduce the inflammation. And Pitakachurna, Kalakachurna, no, I think it's not rarely getting in the market. This also contains the Rasaushadhis. Okay, Pitakasuna and Kalakasuna. And one more thing, Kakarashtaka should not taken while taking this Rasaushadhis, especially Parada and all. Okay. But when we see the Netra Roga Patyas in the Rasakamadenu, they told Karkotaka Karavelaka is the Patya in the Netra Roga. Okay. If you're giving all other drugs, we can use the Karkotaka Karavelaka, we can take. But when we are giving this Rasa condition, Rasa Dravyas, which you are giving, try to avoid to take Karavelaka, especially the bitter gourd should be avoided. Vartakam, brinjal should avoided. Okay. Karira, Shaka, nowadays nobody taking, and different all Shakas should not take. And Sigru also. So many doctors are not advising this to stop the Sigru. Okay, sorry, we can take the Sigru, but only, okay, Sigru is Patyam. Okay, but Apatya while taking the Parada. You see, I'm showing again this slide. Sigru is Patya in Netra Roga, but Apatya while taking the Parada. Okay, doctors are not concentrating on the Sigru. Okay, only if you are giving Parata Dravya drugs, try to avoid the Sigru, Bilva, Kusmanda and all. Okay, Kakarashtaka already you know. And while taking Makshika, Kulutta and Kapota Mams, anyway, nobody is taking the Kapota Mams. I think sometimes people are taking that, we will tell to avoid it. And Vata Gajankusalas, there is no direct reference. Usually Vata Kantaka, in that conditions, you can use Vata Gajankusalas. But who all are, there is a more blinking, there is a nimesham, okay, who all are having that disease and who all are having the pulsations in the eyelids, okay, they will get one pulsations. In that condition, in my practice, I observe Vata Gajankusalas is working a lot, okay. And there is no alternate, I feel, that is my personal opinion. You may using some other drugs, it may be working also. I observed Vata Gajankusalas. Usually I'll give this Vata Gajankusalas. And Arogya Vardhanivati, who all are having the Pitta Vikaras, okay, and Rakta Vikaras, Rakta Janeta Roga, Pitta Janeta Roga, you can add Arogya Vardhanivati also. All Nasa Roga, Mukha Roga, wherever having the Pitta, Rakta, and Icha Bedras also having the Rasa ingredients, and usually we are applying on the this patchy hair fall. Okay, Indralupta and all we are applying Icha externally. Okay, because that Nepalam is there one ingredient. Nepala seed is not available. Icha is applying on that, but apply with the coconut water, coconut oil. Okay, you remember that. Okay, I think I taken more time. Thank you. If you're having any doubts, we can discuss.
Thank you very much, sir, for taking your time to prepare for us such an extraordinary, enlightening session, which was incredibly informative. We shall now go ahead to the question and answer session. Delegates can post their questions in the chat box. There are some questions in the chat box, sir.
Yeah.
Shall we begin with it?
Yes, yes.
What treatment or medicine plan can be made for neonatal glaucoma? Can we use Rasaushadhis?
Yes, we can use. There is actually Rasoushadhi can start from childhood onwards. There is no problem. You can use, but dose. Okay, already I told about the Rasa Sindhura. Okay, in the Rasa Sindhura itself, they told to from 1 year age. From 1 year age baby also we can use the Rasa Sindhura. Okay, like that. Okay, dose we have to reduce. That's very, very important. Small dose only we can use. Okay, no problem. Okay.
Thank you, sir. Moving on to next question. For myopia in 3-year child, what Rasaushadhi can be used?
Saptamurtaloham. You can use Saptamurtaloham. Okay, we take it and Madhu and Glutam. Okay, and that is very, very small dose. Okay, you take accordingly. You use 1/8 tablet. If you already prepared tablets you are taking, means you take 1/8 tablet mix with honey and gluta and give internally. Okay, that is no problem. That is what is my logic is that what I am following is that Up to the 6 years age, I use 1/4 tablet, maximum 1/4 tablet, up to 6 years. Okay. After that, up to 18 years, I use half tablet. Okay. If there is accordingly, if the person is having much strength, and I see the patient, okay, with his how the person is appeared. Accordingly, I will use 1 tablet also. Some people I use 1 tablet also. Okay, along with the Madhu and Gruta. Even though that company is preparing with Madhu Gruta also, you adding also no problem. Okay, we add Madhu Gruta and give. You tell the patient to make it powder and mix with the Madhu and Gruta and give. I don't know whether companies are following, because when if you're taking that, it will come into the all mixing. It will come into the that Loha Basmam is there in the little Jambu Phalavarna. Okay, we take the Kanta Loha only, and Trifala in that we have to mix. And once we added with honey and grutam, it will change into the Istika Varnam, okay, maroon red color. But so many companies, they are giving the black color, okay, black color tablet form they are giving. So if you add properly prepared and given, it will come into the maroon color, Saptamutalo.
Thank you, sir. Moving on to next question. Maximum for how many days we can give these mineral drips, sir?
Maximum we can give, there is a Mandala Kalam. After Mandala Kalam, we have to give gap. Okay, they told minimum 1 day gap also enough. Okay, Mandala Kalam. There is different controversies are there. Usually, so many people they are telling Mandala Kalam on 40 days. Okay, actually, Mandala Kalam means 3 Sapta, 21 days. Mandala Kalam is 3 Sapta, 21 days. Okay, so many people they are telling there is a 40 days also. Some other reference also is available related to 40, but maximum we'll see there is a 3 Saptaha for the Mandala. Yeah, next question.
Thank you, sir. Now we have Dr. Rohit who has raised his hand.
Yeah.
Dr. Rohit, you can unmute yourself and ask your question.
Good evening. Yeah, yes.
Sir, please put some light on the Pita Kachurna.
Pita Kachurna. Actually, Pita Kachurna is not available. Usually, Pita Kachurna is not available in the market. I think in this South India, I don't know, in North India, people, they are preparing. It is mainly indicated in Mukharogas. Okay, all the Mukharogas you can use. That is depend upon the color they give in the Pita cover. Okay, it is in the yellow color. Okay, for that purpose, they told it is Pita Kachurna.
Okay,
This
sir, can you please share its reference, sir?
Yes, I'll show you that. Dosage Ratnavali is there, Pita Kachurna, okay, and this Vangasena, you know, Vangasena and Vrinda Madhava. These books also having the Pita Kachurna reference.
Thank you,
And
sir.
yeah, I think I shown the slide. I will share it once again. Yeah. In Rasakamadenu also is there. Dosage Ratnavali is there, and this Vrinda Madhava and Vangasena. Rasakamadenu reference. This is a Rasakamadenu reference. And one more thing, it is if you prepared, it's okay, because whether companies they are properly doing Manasila Sodhanam or not. And one point I have to tell about the Manasila, in that the Kusmanda, okay, this all are contraindicated. You should not give while taking this Manasila related drugs. Harithalam is there, Manasila is there. But what are the Shodhana Dravya we are using that we can use if the person is getting the complications only. Yeah. Next question.
Thank you, sir. Moving on to next question. Can we use Tutta Basma locally or internally in infant eye diseases?
Tutta Basma you can give internally. Okay, you can give internally. And one more point, Tutta Basmam actually properly purified or not. If you once you check, you add it to the dadi. Okay, if it is coming yellow, that is green color streaks are appeared, so try to avoid to use that medicine. Okay, just mix with the dadi and observe there is a green, it is changing into the green color, try to avoid that. Okay, you give internally only.
Thank you, sir. Moving on to next question. Please tell about keratoconus treatment.
Yeah, keratoconus, actually keratoconus is, there is no proper, classically we can't tell, there is no proper reference for this. We can take this into the Drishtigata Roga, especially in the Timira Kachalinganasha only, in that only, mainly in the Timiram we can include. Okay, so there is irregularities of the vision is present, irregularity of the vision. That irregularity vision can be observed in the Tritiya Patlagata Timiram. Okay, you observe that other sthitiya samibhastandurastam chopristitaha, like that, all the lakshanas they told. In that there is a irregularities can be observed. In the keratoconus also we can observe. So we can tell this as a Tritiya Patlagata Timiram. Okay, so in that condition, what we have to do is that chakshusha dravyas. And usually what I am following is that there is a bandhanam. Okay, bandhanam is very important along with the internal medicine. Okay, rasayana therapy. Rasayana therapy, for that purpose, I used to tell to who all are having the keratoconus, used to tell that you take the saptamutaloha continuously. Okay, after taking that one particular 21 days and all, you give one gap and we take it again. Okay, like that we have to follow. 1 day gap is giving, there is no problem. And Tatpana also very effective in this, and Bandhanam also.
Thank you, sir. Moving on to next question. Please explain the treatment of chronic blepharitis.
Chronic blepharitis. In that chronic blepharitis, we have to clean the, actually it is in Ayurveda can tell as a krimigrandhi. Okay, so Bedanam is the best method. Okay, according to Susruta, we have to do Bedanam, and if it is not possible to do Bedanam, we have to do there is a Lekananjana applications. Okay, Lekananjana applications you can do. Usually what I used to tell is that repeated washing. Okay, repeated washing with the Trifala Kashayam or some baby shampoo, some mild shampoo we can use for the external rubbing. Okay, first we will do rubbing with the finger. We take the baby shampoo on the fingers and we should be rubbed. After that, we can apply the local applications like a secum. If you do continuously secum, okay, that will do. Internally, you take the saptamurtaloha, that is commonly you can use because that is kandugnam. Okay, you can reduce that purpose. We use saptamurtaloha and tamra. Okay, tamra siddha anjana applications, that is also effective. Internally also give the tamram swarnamakshikam along with other drugs. Okay, haritra kanda, such things you can give along with this estimadu churna. You can mix tamra and swarnamakshika, and haritra kanda you can give with the milk. Yeah, next.
Thank you, sir. Sir, can we use Tamra Basma for children's dacryocystitis?
Yes, we can use. But one thing is that Tamra Basma, you should take care while whether which company is properly prepared. Before that, you check once whether it is properly prepared. Okay, then you can give. And in the dacryocystitis condition, usually there is a kapha tridosha predominance is there, and predominantly kapha pradhana tridosha. There is a pus accumulation and everything present in the sac. We have to eliminate it. Tikshnanjanas only we can use. Okay, for that purpose, we use means in the children, it is not possible to do all the Tikshnanjanas and all. Okay, if there is a age is more than 5 years, in that condition we can do Tikshnanjana also, no problem. But in the very small age, we should not use. That we should be give internally. Okay, give internally, and in the team that is Tamra related anjanas, try to avoid, because they will not bear it having that so much of lekana property. for that purpose. You give internally, no problem.
Thank you, sir. Moving on to next question. Rasaushadhis are started after Sadhya Virechana or classical Virechana.
Actually, they told Sadhya Virechana only. Okay, they told only 1 day Virechana. Okay, 1 day Virechana is enough. Next day, the same day itself, the Langanam is very important. Okay, Virechanam and Langanam on 1 day. Next day, we take the there is Patyahara. Okay, Patyahara should be taken. Okay, Patyahara is nothing but we'll take Kshiranam. It is Patya for all. Okay, you can give that Kshiranam can taken. On 3rd day, we start with the thing. And so mainly in the Patyahara means except the Kakarashtaka and all. I think we should remember. Yeah.
Thank you, sir. Moving on to next question. Can quarter spoon of Triphala Churna be added to Saptamrita Lauha to increase the Anulomana action?
Please, can you repeat it again?
Yes, sir. Can quarter spoon of Triphala Churna be added to Saptamrita Lauha to increase the Anulomana action?
Yes, we can. No problem.
Thank you, sir. What is the dose of Lakshmi Vilasaras in allergic sneezing?
Lakshmi Vilasaras usually we give, there is a 1 tablet which is enough, but it is a chronic. If the chronic and patient is more than 25 years, we give 2 tablets also, no problem. Okay, with you mix with in the Dasamula Katutraya Kashaya is there. Okay, you make it powder and you can mix with Dasamula Katutraya Kashaya and give internally. Okay, that patient is get much comfortable with that. They will not get any irritation and all, and sneezings and everything is subsides. And I told no Swarna Suryavarti. Okay, that is also very best drug. Along with that, we give Swarna Suryavarti.
Thank you, sir. Moving on to next question. What is the procedure to use Spatika Basma?
Yeah, Spatika Basma actually that is Fatika. Okay, that is Fatika Tuvari. I told you, no, that we have to take it Tuvari like a Fatika Alam. We take it and take the pan and you fry. Means like especially they are told that Mritika Banda or Mritika Sharavam is enough. Okay, for frying. Okay, you put that into that Sharavam and fry it with a low flame. Okay, with the low flame we have to fry. Means it will become melting. Okay, if you're adding that immediately it melt and water is evaporated from that. Okay, water is evaporated and we'll get the white color powdery and some amount of the like white color small stones like we can get. We'll make it powder. Okay, we'll make it powder and that we use to prepare the Netrabindu eye drops. Okay, that is nothing but Subrabhasma. Okay, after Shodhita we call it as a Subrabhasma. This one we add with okay maximum 5 grams. Okay, 5 grams we add with 1 liter water. Okay, 5 grams powder we add with 1 liter water and we boil it continuously. Okay, so if you want to get more tikshnata, we reduce to half quantity. Okay, you can reduce to half quantity if you need more tikshnata. Okay, that you can filter it and keep in the bottles. Use as a eye drops. Sometimes if you reduce to half, so many people are nowadays people are not preparing that. Okay, when we are studying PG that time we are preparing that. And one more thing is my father is a Ayurveda doctor and he for his patients used to prepare at home. Okay, so we know very well about that and we using that. So you can also start that. Okay, that Netrabindu ready-made is available, but instead of that, if you are prepared, you get confidence to use.
Thank you, sir. Moving on to next question. For
Yes.
how long can Swarna Basma be given in glaucoma?
That is depend upon the patient age, that everything, okay, we have to see Desha, Kala, Varna, Vaya and all we have to consider while giving the all the Rasaushadhi, everything also. Accordingly, so one thing, when your patient is sitting in front of you, you have to take the spontaneous decision and you can give. For that purpose, before that, we should repeatedly, we should know all the doses and what are the anupana we have to give. That everything you should be keep with you. If you want, you making one table and keeping on the table also no problem. We should give the proper thing to the patient. Patient should not get any harm. If you are observing any complications, next time immediately you reduce the dose. Okay. Accordingly, we can give to the patient. Maximum you give Swarnavasma. Maximum you give 21 days. Okay. 21 days. After that, you stop. For 1 week, you stop also, no problem. Nothing will happen. And later, again, you can start the Swarnavasma to get the better results. Okay. Mainly that Chandra Prabhavati and Jalu Kavacharna doing. These all are other things also supporting to patient in the glaucoma condition to reduce the all the pain and along with the increasing the vision. Okay, so Swarnavasma usually you can give with make the Chandra Prabhavati tablet powder also. You make it powder and add the Swarnavasma. Maximum the Swarnavasma we use, okay, 20 mg. Okay, 20 mg we can maximum dose we can give in the adults. Okay, like that you can change the combination. You take first, you can take a paper and write in front of a patient, writing also no problem. Patient should get the benefit. That's all.
Thank you, sir. Moving on to next question. Amla is contraindicated with Loha Basma, but Saktamrita Loha has Amla, that is Triphala with Loha. Please interpret, sir.
Yeah, actually, Amla Rasa is contraindicated, that is okay. But when we are giving Loha Basma, actually, patient is getting benefited with Loha Basma and patient is getting benefited with the Triphala. Patient is getting benefited with the Triphala. And one reference is there in the Rasa Kamadhenu, I think so. In that they told that what are the complications we are getting with Loha Basma. Okay, Rasamitra also they told. Okay, what are the complications are coming with Loha Basma? We use the Triphala. Okay, why? Because that when you take Loha Basma, patient get constipation. Okay, patient get a constipation, they will not get the proper motion. Okay, to get that proper motion, compulsory we give the Triphala. For that only we see the Dhatri Loha. What are the Loha related preparations are there? Kandiva in the Navayas Loha. Now all contains the Triphala. Okay, there is a Dosha Anulomana. Dosha Anulomana should happen. For that purpose, Triphala is added. Okay, so that it is not a actually what are the Amla Rasa in the Triphala, what are the Amla Rasa is there, how much Amla Rasa is there. When we see that Amlaki is the Pancharasa. Okay, sorry, Sadrasam. Haritaki is Pancharasam. When we see that Vibhitaki, there is no Amla Rasa. That is Kasarasa predominant. Okay, Kasarasa predominant is there. Amla Rasa is the little quantity, that is Anurasam, like that. So because of that, Amlaki is having that Pradhana Amla Rasa. Along with that, other rasas also there. So for that purpose, there is, we will not consider that as a Amla. Triphala is not considered as a Amla. Right. Triphala is mainly Kashaya Amla Rasa. Okay, Kashaya Pradhana Amla Rasa. Yeah. Next question.
Thank you, sir. Sir, how to use Tangana Basma in Karna Roga?
Yeah, and actually they told Karna Puranam. Okay, Tankana Basma, Karna Puranam. They told in that reference. Okay, so what we have to do is that that Tankana Basma, if we are putting in the ear, usually Samudra Phenam, what is my plan? Actually, till now I not used that one. I told before while presenting, I not use. What is my idea is that I'll make it powder. Okay, Tankana Basma powder. Usually when you see borax, that powder, it is like a very soft. Okay, So what I felt that we will put in the ear. After that, we will try to move. Okay, after while reducing the pain, it is having that shoshana. Okay, it absorbs all the water. Okay, what is my idea? I'm telling you. It absorbs all the water. That capacity is there for Tankana and Shotahara. Okay, there it is contains a Shotahara effect. So reduce the inflammation. Which all are the inflammatory related pains are developed that will subside. We should not use, they told like Sulaharam, Karnasulaharam, like that we should not use in all the referred ear pains also. Okay, we should not use. We should be analyzed first while giving the patient whether any inflammatory swellings are there, inflammatory pain is there. In that condition, we use the Tankana. Okay, so we make it powder and put in the ear. After that, you try to remove everything and use the one earbud is there. No, that earbud you can dip into the water after removing. Okay, after removing all Tankanam, you take one earbud, dip into the pure water, or else you use in the saline water also, or you can use in the any thylam. You take any thylam. Okay, you dip into that and you mop in the ear. So with that, everything what is the remaining powder is there that will come out. If you are not removed, patient get the itching. Okay, and that powder is moving inside, and patient get the itching sensation, and he will give complaint, and or else he will put something in the ear to remove that itching sensation. Okay, for that purpose, you remove. Okay, take one earbud. My ideas I am telling. Okay, so you also can do same thing. Okay, try to remove all the powder which is stagnated inside. So some amount is water is absorbed. Once the water is like nothing but that is intracellular fluid and extracellular fluid is removed, automatically the inflammation is subsided. The pain will subside. Okay, that is the logic maybe given behind the Tankana in the Karnasula.
Thank you, sir. As we are running out of time, we are now ending the question and answer session. Thank you very much, sir, for patiently answering all the questions. Now I request Dr. Drishya PR, Assistant Professor, Department of Samhita and Siddhanta, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Good evening, everyone. On behalf of Ayurveda College, Coimbatore and Team Diksha, it's my privilege and great joy for me to extend a vote of thanks for today's session. First of all, I would like to express my sincere gratitude to my beloved Guru, Dr. Pundarikaksha Rao sir, for showing light into application of Rasaushadhi in eye and ENT diseases. I'm sure that the participants are immensely benefited by being here. We are all inspired by your words, sir. Thank you so much, sir. Last but not least, I extend my thanks to all our delegates here who are untiringly taking part in our sessions. Hope to meet you all in our upcoming sessions also. Thank you, one and all.
Thank you, ma'am. It's the province of knowledge to speak, and it's the privilege of wisdom to listen. Thank you all for patient listening and the valuable time spent. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session with lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.